everyone. My name is Jessica Porras, and I'm the Senior Manager for Education and Outreach at CAQH Core. I'd like to welcome you today to our Core Certification webinar and virtual dialogue with San Francisco Health Plan. In a Q&A format, you'll hear about San Francisco Health Plan's Core Certification experience. And as background, San Francisco Health Plan provides Medicaid, healthy kids, and healthy workers benefits to more than 140,000 San Franciscans through a network of more than 600 primary care and over 2,800 specialty physicians, and they recently achieved voluntary certification for phases 1 through 3. Before we begin our session, I would like to mention a few logistical items. You can download a copy of today's presentation from the CAQH.org website, and to do that, go ahead and navigate to the Core pull-down menu at the top of the CAQH.org welcome screen and select the Core Education Events page. A link to the PDF version of the presentation can be found under the listing for today's webinar. On this slide, you can see a screenshot of the attendee GoToWebinar dashboard. You should see something that looks similar to this on the right side of your computer desktop. When joining today's session, it's possible you may have joined the audio portion of the webinar using your computer speakers by default. If possible, we'd prefer for you to join the webinar audio by telephone. To do this, please select the telephone audio button in the audio panel of your dashboard, and the dial-in information will be displayed. Make sure you enter your audio PIN, which is found under your dial-in information. And as usual, we will try to save as much time as possible at the end of today's presentation for questions. You're encouraged to submit your question at any time during this webinar by typing them into the questions panel on your dashboard. I would like to thank our guest speaker, Van Wong, Director of Business Systems Integration at San Francisco Health Plan, for joining us today. Today, we will start off with background information about voluntary core certification and the benefits and unique considerations for state and local Medicaid agencies. Then we will have Van Wong give us a snapshot of San Francisco Health Plan, and we will follow that with a Q&A format where we will talk to Van as well as our colleagues from CORE about San Francisco Health Plan's experience, including any benefits and challenges they may have experienced. Then we will have one of our CORE staff share available resources for those of you that are interested in pursuing core certification. And we'll leave time for Q&A at the end. Now, I would like to introduce our first speaker, CAQH Senior Manager Matthew Albright. Matthew?
Thank you. Thank you all for joining us today. We're very proud and excited to have San Francisco Health Plan with us today. San Francisco was one of a number of county Medi-Cal programs that became core certified this year. And I know also we have a number of Medi-Cals and Medicaid programs, both state and local, that are listening in. So welcome to you all, and we hope you find this webinar helpful if you're considering core certification. So what is core certification? Core certification is really the gold standard of what a certification program should look like. The main reason being that it is a certification program designed by the healthcare industry for the healthcare industry. As you may be aware, over 130 CAQH Core participating organizations representing the range of healthcare entities that conduct administrative transactions come together and develop these operating rules. And at the same time, they develop the certification tests for the certification program that entities can go through to test their systems for conformance with those rules. And the CAQH Core participating organizations all vote on that certification test suite. Another element of the program includes the third-party testing vendor. This is a commercial vendor that has expertise in EDI that designs a platform around the conforming test that those CAQH Core participating organizations have developed. And then finally, there's the staff here at CAQH Core that serve as a neutral, non-commercial administrator of the whole process. So why certify? This slide gives some reasons why health plans get certified, and I'm sure our guest speaker will give some insight as to why they were certified. And certainly for health plans, demonstrating conformance with federally mandated operating rules is an important reason. But remember that when you become core certified, you're also assisting the doctors and the hospitals and really ultimately your beneficiaries by offering streamlined, efficient administrative transactions. I know we have many Medicaid plans, both state and local, listening in, and I would say that even if you think you're not ready for core certification, make sure your vendor products and clearinghouses are core certified or they're pursuing core certification. If you have to convince your vendors and clearinghouses why they should get core certified, I'd use that blue column there on the far side and use that for your ammunition. So here's some examples of entities that have become core certified. Note that there are a number of Medi-Cal plans included in that health plans stakeholder row. And again, congratulations to those Medi-Cals on their certification. I'd also like to point out the health plan on that first row with the OMES logo. That's the Oklahoma Office of Management and Enterprise Services. That division runs the health plan for state government employees, and that division became certified. This reflects an interest in state and coming from state and county government health plans, not necessarily associated with Medicaid, but we're seeing those plans as well. Here's a slide that shows the types of stakeholders that can be certified. Again, if you're a health plan, you may not want to become, or you're not ready to become core certified at this point, but do make sure that some of those entities under clearinghouse and vendor, if you use any of those entities, make sure they're core certified, or at least they're following the core operating rules. So this is a map that illustrates the coverage of core certified state and local Medicaid. And as you can see, between the state and county level Medicaids and the commercial managed Medicaid plans, the majority of the country has Medicaid that is offered by core certified plans. And just for your notes, we're zipping through this slide pretty quickly, but we do have this on the website, and you can play with it to figure out exactly which states Medicaids are certified and which managed Medicaids are certified and such. So if you want more information on this, check out our website. So why are these state and local Medicaids becoming core certified? So moving up from the bottom of this slide, core certification, like we said, does give assurance of conformance with federally mandated operating rules. Now, we haven't seen a final regulation on that HHS certification of compliance that is required by the Affordable Care Act, but these operating rules are required to be used by law. And we know that CMS enforces these HIPAA requirements. So a core certification is a good third-party check that an entity is conformant with those federal regulations. But core certification also improves relationships with hospitals and the other providers that serve your Medicaid beneficiaries. You know, in order to make administrative simplification really work, really give the healthcare some cost and time savings, all parties to these transactions have to communicate and talk to each other about how to squeeze the benefits out of these electronic transactions. Now, providers don't really have any rules that they have to follow, frankly, with regard to these HIPAA administrative simplification requirements. But there are tremendous benefits for providers when they learn how to use what the health plans give them through these transactions. We've talked to a few Medicaids that use this opportunity, the opportunity of core certification, to reach out to their providers, urge them to accept electronic funds transfers for their claim payments, or notify them of their ability to access real-time eligibility data and their patient financials. It's nice to communicate with the doctors and hospitals and not be having to tell them something they have to do, but something they can do that will save them money and time. And of course, more streamlined administrative transactions with providers means quicker and less troublesome access to care for your Medicaid beneficiaries. Special considerations for Medicaid when you're thinking about core certification. We know that both state and local Medicaids are not like the commercial payers. With every Medicaid that comes through core certification, we learn more about their unique business processes and special circumstances. And at the same time, we know that any given Medicaid plan will do things much different than the last Medicaid plan that we saw. So here's a number of considerations that we have run into. In some of these cases, we can help with solutions or workarounds, and others, frankly, we may be of less help. But know that as Medicaids, you can always ask us and we'll try to work with you on these issues. Notice that not all of these considerations are negative. Look at those last two bullets. Medicaids do have perhaps more opportunity to coordinate with other Medicaids on implementing the operating rules and becoming core certified. As a simple example, we can help get you in contact with other Medicaids who have gone through the core certification process, and you can troubleshoot with them. Also, if you haven't noticed, CAQH Core loves Medicaids. We really appreciate the fact that Medicaids, with their full plates and their tight belts, tight budgets, are coming forward and taking the time to become core certified. So the core certification application fee is waived for government entities, and you'll note that EDIFAX, this is our core authorized testing vendor, also does not currently charge any entities to take the certification tests that rest on their platform. And with that, I will turn it back to Drew.
Wonderful. Thank you very much, Matthew. And this now brings us to our first of two Insta polling questions that we asked during our webinars. And I will read the question, and then you will see the question pop up on your screen where you can answer directly using your mouse. So I'll read this question and then open it for everyone to log their responses. This one asks, do you anticipate your organization will become core certified in 2016? And I know 2016 is just about half over, so this, I guess, is about the second half of the year here. So I will launch the poll, and we'll pause for just a brief moment for everyone to log their response. And Matthew, I might have you comment on the results. Take about 5 more seconds, and I'll share the results with everybody. All right, I will close the poll and share the results. So the big percentage we see here is 44% indicating that they're unsure, 29% indicating that no, they won't, 16% say that they are already core certified, 6% say it's not applicable, and 5% say yes. Matthew, what do you see from these results?
So I would just have a message for the majority there. The 44% that's unsure, take time. Again, like we said, we can set you up with a different Medicaid where you can ask questions about the whole process. And we have lots of free resources that Taha can talk to you about to help you make this consideration. For the 29% that says no, what I would say to you is that is okay. Make sure your vendors are core certified. So check with your vendors to see if they're pursuing core certification, or at the very least that they know are implementing the operating rules.
And Matthew, for the 29% that say no, it might be that they're not planning on doing it this year, but are considering it in the future. So are there things that they could be doing now, even though they might be planning for it in 2017 and beyond?
Yeah, absolutely. If you're planning for it now, it's a good idea to dive right into those resources. And the other thing I'd say is that if part of your plan is to actually implement these operating rules, then make core certification a part of the test that you do at the very end. Make it a part of your project plan that you would go for that third-person assurance that you're conforming.
Great, wonderful. Thank you, everyone. And so now I would like to introduce our guest speaker, Van Wong, who's from the San Francisco Health Plan. Van is the Director of Business Systems Integration and has been in that position since 2009. In that capacity, she provides strategic direction for business systems integration staff as it relates to overall department goals and objectives. Van manages a team of over 30 staff, including project managers, business systems analysts, and programmer analysts in support of the various HIPAA transactions. And now, Van Wong will give us some background about San Francisco Health Plan. Welcome, Van. Go ahead.
Thank you, Drew. Thanks for letting me share our story, and I appreciate the opportunity. So let's go ahead and go on to the next slide. So San Francisco Health Plan, who are we? San Francisco Health Plan is a public health plan founded in 1997. We serve low-income individuals in the city and county of San Francisco. We are part of the two-plan model in San Francisco County, which comprises a commercial plan and a local initiative. We are that local initiative in San Francisco County. Now, local initiative comprises 5.7 million Medicaid lives in California, and there are 16 California local health plans. These local health plans are not-for-profit, publicly governed managed care organizations that do not compete against each other. So it's a really great forum for us to collaborate with each other. San Francisco Health Plan owns 86% of the Medi-Cal market share in San Francisco. which ranks us as #2 for local initiatives in California. And that's an amazing feat for us. Next slide, please. There are 6 models of Medicaid managed care plans in California, and this slide represents those. I'm not going to go into the detail of what they are. Feel free to read them at your leisure. But depending on the county or region, the model is different. And the 16 local health plans that I mentioned represent these various models. And we are the 2-plan model. Next slide. So why do we exist? We exist to provide high-quality health care to low-income members in San Francisco County. We currently provide health care coverage for 1 in 8 San Franciscans. And we also help to lower federal, state, and city costs through cost-effective quality care focusing on preventive health. And last but not least, we're here to protect the safety net providers in San Francisco. Next slide, please. San Francisco Health Plan has 4 lines of business, with Medicaid representing 83% of our membership. We also serve as a TPA, which is a third-party administrator for the Department of Public Health. If you've ever dined in San Francisco, we want to thank you for your support of our Healthy San Francisco program. Next slide. As a health plan, we support a variety of data exchange, including your basic claims, encounter, enrollment, and authorization data. Due to varying technical capabilities of our provider, we support a lot of proprietary format, including Excel, which causes a challenge for us when we're trying to standardize our exchange. Next slide, please. At San Francisco, we're constantly looking to provide our members with better access to holistic health care while pursuing industry best practices. So as you can see, we have a variety of things happening throughout the year as well as beyond. So for this year, we're pursuing implementing telemedicine in order to provide online office visits and behavioral health appointments for our members. This is in hopes of improving their access to care. We're also expanding our Medi-Cal product line by transitioning some of our Healthy Kids member over into Medi-Cal. Next year, we hope to achieve NCQA accreditation in order for us to achieve those gold standards. And we'd like to implement Health Homes, which is a comprehensive care coordination service for members with chronic conditions. And ultimately, there's bigger initiatives in store for us as the healthcare industry continues to change. In 2019 and beyond, we're looking to take on Medicaid special needs plan, as well as to transition California Children's Services over to managed care as the state begins to move more services to managed care. So there's a lot on our plate, and we're really excited to be able to do best practices in terms of operational efficiency through CORE in order to achieve some of these. It's definitely an exciting time to be in this industry, and having as much operational efficiency as possible will ensure that we keep costs low while providing quality healthcare services to our members. We're San Francisco Health Plan, and we're here for you. Thank you, Drew.
Thanks so much, Van. You guys are doing some really remarkable work. So this, once again, this is Jessica Porras, and I'll be moderating this portion of the webinar, which is a little bit more of a dialogue format with Van from San Francisco Health Plan, as well as Matthew Albright and Praha Anjarwala from CORE. So let's begin. So Van, why did San Francisco Health Plan choose to pursue voluntary CORE certification?
So there's a variety of reasons for why we did that. One, as we said earlier, Matt highlighted this, is really to ensure that we have operational efficiency for real-time transaction. But ultimately, it was really for peace of mind. We wanted to be able to provide proof that we're CORE compliant. It's good to say that you're compliant, but it's much better to have an independent body confirm that you are CORE compliant. So definitely lets me sleep better at night. And then it also happens that the vendor that we were working with is the certification entity for CAQH CORE. So there was good synergy for us to pursue that effort. And ultimately, as Matthew says, you guys love Medicaid, so free is good for me. So that's why we did it.
That's great, and we do love Medicaid. We should have put a heart emoji on that map slide. So Matthew, a question for you. I mean, is what Van is saying consistent with what you're hearing from other entities that are core certifying?
Jessica, yes, I think we've seen many health plans come in to get certified because they need that assurance that Van was talking about, that they are conformant with the federal regulations. And like I said, the certification of compliance mandate in the Affordable Care Act, and that's the one with the big penalties, hasn't been codified yet in regulation. But CMS has other mechanisms for enforcement, and we know they're pursuing those. And we've also seen where health plans are integrating core certification as their broader systems upgrades, as their broader project plans, as I said before. It fits in well as that final or penultimate step of implementation or updating your systems, because health plans then have that third party, again, to kind of confirm what Van was saying, that they can use to confirm that they're conformant with the requirements.
So a follow-on question to this discussion, Van, were there benefits to choosing to core certify now rather than wait for the final certification of compliance rule to be mandated or determined by the federal government?
I think for us, definitely, we wanted to certify it before the final compliance rule so that we could keep up with industry standards and provide better solutions to our trading partners. Having real-time access for them is important to us, and the fact that we did the core certification now really helps emphasize, our commitment to that effort. So definitely yes.
So Matthew, will you reiterate for us what you see as the main benefits for pursuing core certification?
Yes, and I think I'm going to kind of echo a lot of what Van said too. I think for health plans and for vendors and clearinghouses too, it's really a message to providers and members, beneficiaries, and other trading partners that the health plan is doing all it can to cut those administrative costs on behalf of their trading partners and their members. Offering EFT and using EFT operating rules is a good example of this. We've seen many anecdotes of providers that have saved a lot of time and money by taking advantage of electronic payments and those operating rule requirements surrounding how those electronic payments need to be sent. And of course, implementing operating rules and become core certification usually means some process improvements occur within the health plan itself. A good example of this are the operating rules that require health plans to provide real-time eligibility and claim status responses to providers. Processes change, resources are reallocated, and the health plan may find that there are less phone calls and manually working through these eligibility and claim status questions.
Great. I'm going to change the topic of this conversation a tiny bit to the topic of working with vendors. Van, why did San Francisco Health Plan choose to pursue a vendor solution?
So this actually aligns with what Matthew was saying earlier about process change having to happen internally within the organization in order to be able to support real-time transactions and meet core compliant. So first off, San Francisco Health Plan is not a 24/7 shop. In terms of ongoing support, it would be an issue for us, and being able to ramp up to 24/7 would be very costly to support core requirements. And so ultimately, we decided that a vendor solution would be quicker speed to market for us, as well as less costly. And additionally, our internal staff didn't have the expertise at the time to be able to support a 270, 271, and the 276, and all those other core requirements. And so it was prudent for us to choose a vendor solution and partner with people who had the expertise and who can help us acquire those expertise through time.
So Van, I'm going to hone in on that point a little bit more. How did you choose your vendor, and were there other people you partnered with to help make that determination?
Yeah, definitely. So at the time, we were actually very fortunate. Our sister plan, which I had mentioned earlier in the presentation, one of the local initiatives, was already doing a core compliance assessment with a vendor and recommended this vendor to us based on their how they've delivered thus far. And so a couple of the sister plans chose the same vendor to do the assessment, and based on the assessment, we also continued on with this vendor and pursued them to do a solution for us that was a SaaS model. And what was really beneficial about this particular decision was that this vendor already had the expertise. Now, not to name the vendor, but they are the certifying, the testing agency for CORE. So it made sense for us to pick someone who really knew what they were doing, and also the fact that we were able to partner with 4 other local plans in California, we were able to negotiate a win-win deal for everybody.
That's great. I have a follow-up question for Taha. Particularly given the makeup of the audience for today's webinar, are there any best practices or things that they should be thinking about when they're choosing the right vendor?
Yeah, so that's a good question. And kind of building off of Dan's points, there are several items that organizations should consider when choosing a vendor for implementing the operating rule requirements. The first item that we see is considering the type of function that you need the vendor to perform on your behalf to meet the operating rule requirements and your organization's business needs. So for example, your organization may be already conducting transactions via EDI, but your organization may may not support core connectivity methods. So you may be able to narrow down a vendor list and choose a vendor that provides connectivity-only services. So one of the helpful resources that I'll talk about later on today's call would be the analysis and planning guide that can help you identify those gaps. Once you have an idea on the type of vendor that you may need to partner with, vendor engagement is also important to consider. You'll want to make sure your vendor is easy to work with and will coordinate to work with you during operating rule implementation and core certification testing, because oftentimes we see vendors taking testing tasks on behalf of their organizations. Another resource that we have is that if you choose to outsource to a vendor, that vendor must be or become core certified prior to your organization being able to achieve core certification. So with that, we have a list on our website of core certified vendors and clearinghouses, which may help your organization in the vendor selection process. And or if you already have a vendor that you're currently working with, you can use this list to see if your vendor is currently core certified.
So when I was listening to you, Taha, talking about vendor engagement, I was thinking of engagement in general. So Van, how did you keep the communication flowing with your providers so that they knew what the new data requirements would be when you implemented the operating rules?
So we already have a lot of channels in terms of communication with our providers. We have our monthly provider newsletter that we would publish status of what was going on with some of our major initiatives, including core certification process. We also have biannual provider data quality meetings, jams, etc. So there was a lot of in-person communication as we would meet with these provider groups throughout the year for various purposes. And then we also had a newsletter, our portal, so it was continuous communication throughout the process.
Great. So specifically while you were going through the certification process, did you encounter any challenges or any lessons learned that you think our audience, that you want to share with the audience?
Yeah, it definitely was not a walk in the park, even though we're done with it. First off, I just want to acknowledge my staff who helped achieve this process. It was a really amazing job that they did, given all that we had to do at the time, including other initiatives. So in terms of the challenges, some of the things we had was, as I mentioned earlier, lack of in-house experience and expertise around some of the existing transactions that were being supported by CORE. So it was really helpful to have a knowledgeable vendor that helped guide us through the process. Additionally, with Medicaid in California, there are usage of local codes that aren't nationally recognized. So we had the challenge of having to do a lot of communication with our providers around usage of local code and the inability to have a core compliant transaction if they were to pursue that local code usage. So that was a bit of a challenge in terms of talking through that process and determining what our policy would be around that. Additionally, we had no available trading partner to test with during the certification process, so that was a bit of a challenge for us, and therefore we had to make up a lot of our own test data, and I think Matthew referenced this earlier as stuff that you guys would support. So that was a lot of extra work that we had to do, and being able to get through that was just an amazing job by the team.
Well, Van, it's good to know that you guys overcame these challenges And I would like to ask Taha, if there are entities going through certification right now that are currently experiencing either these challenges or other challenges, what should they do?
So we offer a variety of resources and tools to help organizations work their way through the core certification process, especially through any difficult challenges or issues they may be experiencing. All of our resources are available on our website and are free. Some of these resources include the Analysis and Planning Guide, referencing FAQs. We have educational learning modules, and also recordings from previous webinars from other entities that have talked about some of the challenges and lessons learned that they have overcame. We also encourage organizations to submit any issues they may be experiencing via email, and their team will work to find solutions to these challenges to kind of help you move forward. And we're always willing to work with you and kind of finding next steps for you. Also, we're more than happy to set up a conference call with your organization to address any questions that you may have, from very general down to the technical details. And that's also a free resource as well. Further, we can help put you in touch with other organizations that have completed core certification and that may have encountered some of the same challenges that you may be experiencing, which can help serve as another resource for your organization.
That's great. So for the last question, so we can end this segment, I'd like to change the topic, Van, and talk to you a little bit about, kind of healthcare in general. So for San Francisco Health Plan, what are the biggest challenges and opportunities that you're facing right now, and how are you addressing them?
So I think for us, the state of California is really looking to transition more and more services to Medicaid managed care in an effort to reduce healthcare costs. So they know that Medicaid managed care can help manage costs a lot better than fee-for-service. So this is a fantastic opportunity for us because we're trusted to manage more of a member's care. However, that's also a big challenge because we need to be able to scale appropriately to ensure that we can deliver on these services through operational efficiency. So like many health plans, we have an integrated infrastructure that includes both homegrown, off-the-shelf, and SaaS applications. So we're paying a lot for a data integration tax. And we definitely need to make sure that all of those things are working properly. So we're constantly evaluating whether our current setup is the most optimized one for our own success and to be able to scale up to take on more services and take on more members. So currently we have an initiative in place where we're looking at our core managed care system and how it's being configured in order for us to decrease the time to market for any new business initiative. And that's been our big focus, is how do we scale upwards as we're increasing our membership.
Wow, well that is an amazing answer and an amazing challenge. I mean, as you grow, you're continuously changing to address these new needs, so it's great to hear. So I think now we have some time for another polling question. Drew?
Yes, thank you. Thank you, everybody, for that, that part of our webinar. And this brings us to our second and last polling question of the webinar. And just like last time, I will read it and then launch the poll for everyone to respond. And this question asks, how many of your business partners or the product services you use are core certified? And I will launch the poll. And we will take just a brief, maybe 10 or 15 seconds for everyone to respond. And I might have someone here comment on the results, maybe Matthew. We'll take about 5 more seconds. Take about 2 more seconds. Just click right on the screen. All right, I'll close the poll and share the results. The largest percentage you see here is 52% indicating that they don't know, followed by 37% saying some. Matthew, what do you have to say, I guess, particularly to the I don't know crowd?
Right. Well, I'm going to start with the positive, right? But it's good to see that that there's some knowledge out there about the vendors and that there's at least some of the vendors have been core certified. And for the I don't knows, again, I would just urge again, ask the question. And if not core certification, core operating rules and HIPAA administrative simplification requirements. Just make sure your vendors are in the know about that and, if possible, core certified. As well, it could be that many of your entities are core certified, so it's not just because they're not wearing it on their badge plates. It could be that they are core certified. And we do have a page on our core webpage that lists all the vendors and clearinghouses and health plans, for that matter, that are core certified. So I direct you to that list, and maybe next time we take this quiz, then we'll have less on the I don't know.
And that list changes, right?
Absolutely. And I would say, yeah, we keep that as soon as an entity gets core certified, they show up on that list. And I know there's also quite a few vendors and clearinghouses listening in as well. And you start wearing that core certification badge proudly, because we're telling a lot of health plans to ask their vendors. So show up at the door with that one.
Wonderful. Thank you, guys. And so next, I would like to introduce CAQH Core Senior Associate Taha Anjarwala, who will be walking us through the core certification resources that we offer. Taha?
All right. So CAQH Core has published a variety of resources to help organizations progress through core certification from start to finish. The best place to start off, if you're wanting to learn more about core certification in general, is to navigate to the core certification page. So on this page, this core certification page is directly accessible from the CAQH homepage. To access core certification content from www.caqh.org, hover over the core button or the tree image, which will then pop up a menu of links for core-specific content. The core certification link should be clicked next, which then will move you to the core certification landing page. So once you're at the core certification landing page, there are 4 main content areas. The first content area is core certification in general, which provides an overview of the core certification program and the ACA Section 1104 mandated certification process. The second content area is more information on the core certification process, which provides step-by-step directions on how to navigate and work your way through getting core certified. The third content area, which kind of talks more about that last polling question we had, is the core certified organizations page, which highlights those organizations who have completed or pledged to complete core certification. So if you're unsure of whether or not your vendor is core certified, you can navigate to that link, and that will bring you to the list. The fourth content area is the core endorser page, which highlights organizations who support the core's mission of operating rules, but cannot use, create, or transmit the transactions themselves. So next up, I'll be talking more in detail about the core certification process page and the 4 main steps required in order to become core certified. So information and resources about the steps involved for core certification can be found by navigating to this page. The process page is divided into 4 distinct areas outlined by component. The component number 1 outlines information and links to materials related to plan evaluating systems prior to the beginning of the core certification process. Resources included here are the core certification policies, the operating rules, analysis and planning guides, and many others. The second component outlines information and links to materials related to signing and submission of the core pledge. The intent of this pledge is to formally communicate your organization's commitment to pursuing voluntary core certification. The third component outlines information and links to materials related to core certification testing. Resources here include the CAQH core test suite and information about the core authorized testing vendor. The fourth component outlines information and links to materials related to the application process for the core certification seal. The application process includes completion of the core seal application and a HIPAA attestation form for each phase that you're applying for core certification. So next slide, please. So this slide highlights some of that pre-certification and system evaluation resource. CAQH Core offers a variety of these resources to help organizations gauge their ability to adopt and become compliant with the operating rules. One of the most helpful resources that is used by many organizations is the CAQH Core Analysis and Planning Guide. The Analysis and Planning Guide helps organizations understand the applicability of the operating rule requirements to their organizations. They help identify internal and external system impacts and aid the development of project plans for any remediations for any identified system or software gaps. The Analysis and Planning Guide is available for all phases of the operating rules on phases 1, 2, 3, and 4, and it's free for organizations to use. Next slide, please. Another valuable resource that other organizations have found helpful are the CAQH core FAQs. There are over 100 of FAQs available for organizations to use as a resource when implementing the operating rules and pursuing core certification. FAQ topics include those that address the operating rules from general concepts to more of those that are technical, questions related to core certification, future operating rules and development, and many other topics as well. One thing to note, our FAQs are searchable, so if you have any question in mind, type in some keywords to your question in the toolbar highlighted in the slide, and a relatable FAQ should display on your screen. So if you need any support or have further questions about core certification or core in general, feel free to reach out to us via phone or email either at 202-517-0375 or submit a question at core@caqh.org. Additionally, if you have questions specific to core certification testing, you can reach out to the CAQH core authorized testing vendor Edifex at the email address displayed on the screen. We welcome any questions that you may have and would be happy to provide you support or guidance via phone or via email. One last thing, CAQH core is working diligently with the core authorized testing vendor Edifex to develop the phase 4 test site. This test site is expected to be completed by late summer 2016. So if your organization is interested in becoming the first to become phase 4 core certified, feel free to contact us at core.caqh.org. We'd be happy to talk with you and taking that next step in phase 4 core certification. And I'll turn it back to Jessica.
Thank you so much, Taha. And we do have time for questions. I'd like to remind you all to please submit your questions by typing them into the questions panel on your dashboard. So my first question is for Matthew. What is the status of the HIPAA credential NPRM?
So the HIPAA credential, that's a term that was used in the proposed rule on the certification of compliance. Certification of compliance is an HHS program that was mandated by the Affordable Care Act. There was one proposed rule in January of 2014, which indeed proposed something called the HIPAA credential and also proposed the core certification seal as possible documentations of compliance in order to meet the ACA mandate. Since that proposed rule, we haven't seen another rule. What we have heard is just in May, there was a notice that came out of the feds that said that they expect a new proposed rule to be coming out in June of 2017. So in a way, we're reading the tea leaves, but we're in a holding pattern until we see a new regulation. And like I said, it looks like the notice from the Fed says next year at about this time we can expect that regulation.
So I think this is another one for you, Matthew, perhaps for Taha. So how can CAQH core write the rule and then be responsible for determining certification?
So this is a great question. I like this question. First, let me say that it's pretty common practice, not just in this industry, but in just about every industry in the United States, in accreditation and certification programs. There are a number of examples where, a great number of examples, where there's a group that both writes the rules or standards and then develops a test or certification or accreditation that proves that you meet the rules or standards. NCQA and Joint Commission, you're probably both familiar with. They both follow this model. And notice that a number of state governments recognize the Joint Commission accreditation as a condition of licensure. Second, let's clarify that core certification proves that an entity's system or product has passed conformance testing. And conformance testing is a kind of term to art. So if you were to say Wikipedia that term, conformance testing, you'd find that the entity that writes the rules is often the same entity that writes the conformance test. It's common and appropriate for an organization that has written specific requirements or standards, that is the organization that knows how the rules should be used, to specify the type of testing that would have to take place in order to prove that conformance. And what we pride ourselves on is the fact that the operating rules and the core certification testing are both developed and voted on, not by consultants or by a group of experts, but by core participating organizations, of which there are over 130. These are organizations that actually use the transactions on a day-to-day basis, and they're the ones deciding what the rules are and how an entity can prove that they're being followed through conformance testing. Last thing on this, CAQH Core does not certify compliance on behalf of the federal government. Core certification was proposed as a document, like we talked about, that health plans could present to the government to demonstrate that they are compliant. But notice that the proposed rule never said that the core certification proves compliance. It just proposed that a core certification is one of the documents that should be presented. It's like a driver's license, right? It's a piece of paper that proves that you took a test in which you conform to the traffic laws, but it certainly won't get you out of a ticket, as most of us know, if you break those laws. And the last part of this is, yes, the industry, as we talked about, developed the core certification conformance testing, and it developed the operating rules. And then we turned it over to a third-party operating, a third-party vendor to actually conduct the test. And so that's, again, kind of a separation of powers for us. It's not us that does the actual testing. It's a commercial vendor, a third-party vendor that does the testing, and we're kind of the objective neutral party that looks at those tests and awards the seals.
Thanks, Matthew. So the next question is for Denise. And the question is, does CORE have any comment on NCBHS's recommendation that Phase 4 remain voluntary?
Okay, this is Denise Benning. I'm the director of CORE. And in terms of, actually this is kind of a two-part question. As I'm seeing on the screen here, it says any comment, and then is there an ETA for the next step? I think you all, if you're a CORE participant, you're probably familiar with the fact that the NCBHS drafted a recommendation letter to Secretary Burwell of HHS regarding the Phase 4 rules, and basically came to the conclusion that for a number of reasons that they noted, that the Phase 4 rules should remain voluntary right now and not necessarily mandated. We responded to that letter to NCBHS, and we also sent a letter out to our CORE participants. And the one thing that the NCBHS stated was they strongly supported the use of Phase 4 on a voluntary basis. So what we did was we asked them to clarify a number of points, one of which was, could they define with more clarity exactly what kind of voluntary support HHS could provide for the Phase 4 rules. We also asked for some explanations in terms of some of the existing statutory requirements, as well as some of the definitions that they were using. And they also said that they thought that Phase 4 should be tested more extensively. Well, we're all in support of testing at any level. However, they need to help us define what kind of testing and what would that look like. So we asked a lot of questions, and we're hoping to get some answers from NCBHS on this. But in the meantime, we are definitely going, again, with voluntary implementation at this time. And also, I think it's an interesting testimony that we're getting a lot of inquiries about core certification for Phase 4. They're coming in quite heavily. So I think that, and I'm going to echo one of our previous guests on our webinar, one of the Humana representatives who's involved in our beta testing of the Phase 4 test suite, who said they mentioned to CMS that we can't wait, the industry can't wait for the government to mandate things, that we have to go ahead with good business practices when we see them and they strongly urged phase 4 to go ahead on a voluntary basis. So right now we have no ETA in terms of what the response might be, but we're very heartened by the fact that there's tremendous industry support. And again, the vote on this was 88% approval, 90% of the core participating organizations voted for this, and they represent more than 70% of this country's commercially insured. So I think that was a very strong message that we sent back and continue to send back to both the department and to NCBHS.
Thank you so much, Denise. I've got a question here asking about whether providers need to be core compliant. Matthew, would you comment on that?
Yes, and so the Affordable Care Act does not require providers to get core certified. In fact, they don't require any certification for the providers at all. That ACA mandate applied only to health plans. And let me say more generally that there are some operating rules which are required by the federal government which do apply to providers. But there are, statistically, comparably, compared to the rules that apply to health plans, they're very few. What I want to say is that how this affects providers on a practical level is there's a lot of benefits to the health plans using these operating rules for providers. And so for providers, in terms of your relationship with the operating rules, find out if your health plans are using these operating rules, which they should be, and then find out if your vendors, your software vendors, your practice management systems are taking advantage of those operating rules. There's more robust data content in the claim status, eligibility, and ERA. There's a lot of rules about acknowledgments. There's a lot of rules about things that would make your life easier in terms of accepting these electronic transactions. And so, again, I'll say it again, the providers, not a lot of rules that apply to providers. Providers are certainly welcome to get core certified. It's a sign that you're using the data that comes through these electronic transactions in a very efficient way and making things better for beneficiaries. But the rules themselves are very slight. And one more thing on this, because we had a related question. There was a question about what the difference is between ProView and the accreditation issues with CAQH ProView and CAQH core certification. So core certification is certification that entities are following the operating rules. Those are required by the federal government, and these are the administrative transactions. ProView, on the other hand, is a provider database, so a database for physicians and hospitals, and oftentimes the health plans will use ProView to start your accreditation practice. And so if you're a provider and you're listening to this, ProView, CAQH ProView is definitely, is probably a part of your credentialing service. And if you're told by the health plan to go to CAQH, that's probably what they're talking about.
And they can go to the CAQH.org website and find more information about ProView if they're interested, right? So Taha, the next question's for you. Does EdFX have a Medicaid specific test bed?
Data.
All
right, so that's a very good question because Medicaid definitely have a lot of unique challenges when incorporating the test bed data for testing the eligibility transaction for core certification. So unfortunately, the test bed data is standardized to work across all stakeholders, all health plans and providers, vendors and clearinghouses. But one of the unique challenges that we see a lot of Medicaids having is with the test bed data. Specifically, for one example, is the test bed data has different deductible amounts, and typically Medicaids have $0 deductibles. So we do tend to work with Medicaids, and I believe Dan had touched on some of the unique challenges that some of the Medicaids have. So if you're experiencing some of the issues with test bed data, feel free to reach out to us at CAQH Core, and we would be glad to work with you on some of the issues or challenges you're experiencing with getting the test bed data uploaded into the test environment, and so that you may be able to complete core certification testing.
Great. So I'm not sure if this next question is for Taha or for Matthew, but here it is. If the claims are adjudicated electronically by a third-party vendor, but the payments are manual by check, do the core operating rules apply, and what kind of certification should they get?
So core operating rules do not apply to manual or paper processes. The core operating rules and the HIPAA standards apply to electronic transactions of those administrative transactions. However, I just want to comment on something that's kind of somewhat implied by this question. That being said, every health plan is required by HIPAA to be offering electronic transactions. So if you're a health plan, you are required to offer electronic transactions. For instance, you are required to offer electronic payment for claim payments to your providers. And you can offer a manual process as well, but the electronic is required to be offered, and when you offer it, it has to be according to operating rules and standards.
Thank you, Matthew. So the next question is, we're utilizing a clearinghouse for phases 1 and 2, and would like to know what we have to do to begin our testing process. And I'm assuming that this clearinghouse is not core certified in this question.
Sure. I'll take this one. So if you're not sure if your clearinghouse is phase 1 or 2 core certified, I would recommend by going to the core certified organization page on our website to kind of determine and go through that list on the clearinghouse tab to see if your clearinghouse is phase 1 and 2 core certified. And in the case that your clearinghouse is not core certified, then your clearinghouse would have to go through the core certification process in order to become core certified before your organization can become core certified. And I'd like to note, after that clearinghouse gets core certified or is already core certified, core certification is relatively easy for your part. With core certification testing, you would just have to make reference that you're outsourcing that test component to the clearinghouse.
Thank you, Taha. So we've got a question from a TPA. So Matthew, I think this one's for you. I'm sorry, I can't read. So do these requirements apply to TPAs that contract with commercial plans?
Okay, good question. And I see there's a couple of questions about TPAs. So these requirements, the operating rules requirements, the standards, would apply to all HIPAA-covered health plans. Group health plans, that's self-insured or fully insured health plans, are considered HIPAA-covered health plans. If you're a TPA and you work for a group health plan, for a self-insured plan, then you should be also, and you conduct these transactions, or you hire the vendors or contractors that conduct these transactions, you need to be compliant with these requirements because you are conducting the transactions probably as a business associate, but you're conducting these transactions on behalf of a health plan that is required to do so. And I would also note that with the privacy omnibus rule that we see came through, there's a lot of responsibility and liability now on business associates. So it won't be the health plan, your group health plan that you represent, that might get in trouble with this. It would actually be the TPA that is required to be doing it.
Thanks, Matthew. So we have time for one last question. And this could be a quick answer or maybe not. So it starts out with a statement. I submit 98% of my claims electronically directly to the payer, and I receive electronic COB. Do I need to be core certified?
So you do not need to be core certified. It sounds like you're a provider because you're submitting claims to a payer. Providers are not required to be core certified. Providers can become core certified if they're conducting electronic transactions. And for the example you gave, the phase 4 rules apply, which are voluntary at this point. And there are some requirements that providers could meet, voluntarily could meet in order to be core certified, and those are mostly connectivity requirements. But again, there's no federal mandate. Definitely for providers, core certification is voluntary. And in general, and you probably know this already, you're submitting your claims according to the standards, adopted standards by HHS. And for the most part, you don't have a lot of operating rules that apply to that.
Okay, so I'm going to do one more question just because I think it's an important one, even though we're running a little bit out of time. It's another question from a CPA. So they're using a CPA to process claims on our behalf, and that CPA is course certified for phases 1 through 3. However, this entity houses the eligibility, and they've been looking to do 834s themselves. Can we get certified independently for those 834s?
Again, I think it sounds like a health plan, and I'm just going to guess from this example, but I think we'll take this example and take it offline and contact to make sure I have it right. If you're a health plan and you want to get core certified, you do have to get core certified sequentially. So you do have to be certified in phase 1, phase 2, phase 3, and phase 4. So if you're a health plan and you contract out the eligibility claim status and EFT and ERA for the first 3 phases, you would still have to get certified. Like Taha said, if somebody else is doing that job for you, it's fairly easy to get core certified for those phases that you're doing, that other people are doing for you or other contractors are doing for you. Nevertheless, you do have to get certified if you want to get phase 4 certified, and the 834 is a phase 4 transaction.
Thank you, Matthew. And for those of you who submitted questions and either we didn't get to them or we didn't quite answer it because we didn't have enough information, feel free to, send a follow-up question to our inbox, and we will be happy to respond. So I'd like to thank our speakers, especially our guest speaker, Van Wong, for joining us. And this slide gives you some takeaway messages from this webinar. A recording will be available on our website in the next 24 hours, and we will also send it to everybody who registered for this webinar. Also, please register for our upcoming webinars. We have more and more. There's actually one more on the website that's not on this slide, so keep checking back for our future programming. In the next slide are some links and some ways to connect with us, and that's it. Have a great afternoon. Thank you.
Thank you.
Thank you.
And